Welcome to Eurofins Viracor Clinical Diagnostics Podcast, where I'll be sharing up-to-date scientific advances, key diagnostic testing, and our most recent innovations. Enjoy part 4 of our 10-part series, originally broadcast live from ATC24 in Philadelphia.
Hi, this is Kevin again with Eurofins Transplant and the Viracor Reviews. We're sitting live at ATC, American Transplant Congress 2024. Great guest this afternoon. Excited to have you. Sitting across from me is Dr. Alin Gragossian. And
good to be here.
Happy to have you sit down and talk to us. Got quite a storied past that we're going to delve into a little bit. Talk about your history with organ transplantation, what you're doing now, what you'd like to see happen go forward, and like that. We're just two friends having a conversation. So if you'd like to go ahead and introduce yourself, Alin, give our listeners a little bit of insight. I'm sure they know who I am by now.
My name is Alin Gragossian. I am a heart transplant recipient from 2019. I am also a physician, so I trained in both emergency medicine and critical care medicine. I practice as an intensivist now, and I'm also an associate medical director at an organ procurement organization in California. I guess most importantly, though, I'm this year's outgoing chair of AST's Transplant Community Advisory Council, where we do a lot of patient advocacy work for patients with transplants, living donors, and donor families.
Very good. And when you're not doing that, you have a blog post called A Change of Heart. You want to give us a little bit of information on that?
I do. Back in 2019, I started a blog called A Change of Heart, which I didn't think would be anything special. At that time, blogs were kind of a bigger deal. And I started writing about my experiences as a patient/doctor going through everything that I had gone through, and I continue to have it till this day, although I will say it's not updated as much as I'd like it to be because I have been pretty busy, but I do like to write.
And in addition to that, you also serve as a co-host with another heart transplant recipient, Dr. Colby Salerno, called Both Sides of the Stethoscope.
Correct. Back in 2019, when I first got my heart transplant, I didn't think there were any other physicians with transplants, let alone heart transplants, and that's how I met Colby through social media. He had been a heart transplant recipient for about 5 years at that time, and he told me, he said, I'm an internal medicine resident, and I've also been through a heart transplant, and just ask me anything and I'll help you through it. So it was a really, really great friendship that started 5 years ago, and we're good friends till this day. He had always had an idea about possibly either having a website or a book or a podcast about being on both sides of the stethoscope, so I was really excited to help him with it.
So tell us a little bit about, what is both sides of the stethoscope? What do you talk about? What information do you provide? And how does that help people going through the transplant process from the point of either, oh my gosh, I'm going to need a transplant, to, okay, now I've got a transplant, what's my life going to look like afterwards?
The podcast itself focuses a lot on what we can help do to help patients understand the medical world better. We do tend to focus on transplant because we're both transplant recipients, but sometimes we do delve into broader picture, like people who've had cardiac arrests or heart disease or any other cardiac injury or chronic illness. But we do focus on transplant, and we kind of try to give our insights or have guest interviews about different aspects of medicine that sometimes patients don't always have easy access to. So we like to educate people about what the transplant process is like, or what we did an episode recently with a couple of transplant pharmacists about the different medications we're on. We talk about things like myth busting and organ donation. So it's pretty broad, but it's fun, and we both kind of do it as like our hobby, which makes it even better because I feel like we both really, really love doing it. And if we don't have time, it's not. Sometimes we skip an episode or two because we're both busy, but we do try to do at least consistent episodes once a month.
Well, that was a really interesting point you just made about myth busting, because I think there's a lot of negative of myths out there about organ transplantation and being an organ recipient. What are the, I don't know, I'm not going to play David Letterman, that's for your top 10, but how about maybe top 2, 3?
Sure. There's a few. One that I always get told is, I heard that if I'm a registered organ donor, doctors won't save my life, and they're going to kill me for my organs. And what they always say is they're going to kill me to harvest my organs. First of all, I always say it's not called harvesting; it's procuring organs. But also, that is absolutely impossible. I not only work as an intensivist, but I'm also on the OPO side too. So I do donor management as well through the Organ Procurement Organization, and that is absolutely never, ever the case. In fact, even if there was a rogue doctor out there who wanted to do that, there would be no incentive, and they wouldn't even know who's an organ donor and who isn't. The registry is handled by a completely different party. Mm-hmm. So it's not something that, it's something that I get asked even till this day all the time. And then another common one is people who think that if you are an organ donor, you can't have an open casket funeral if you're a deceased organ donor, and that is also false. In general, open casket funerals and whatever ceremony needs to be done or is done with your culture is they are able to do it even after organ donation and procurement.
Right, 2 very important points. The other aspect of that too is, we think about it, or historically we've thought about organ donation as being deceased organ donation. Now we have more and more people stepping up to be live donors. What has your experience been with that, as you've gone through this process? And
I think living donation is amazing. That is one of the many ways we can decrease the number of people waiting for transplants. It's a fairly easy process. Of course, some people don't know how they're supposed to start the process, and I always kind of refer them to a nearby transplant center because it is not handled by the Organ Procurement Organization. So it's a separate process, but it isn't too difficult. And then the surgery itself, generally doesn't come with complications. Through AST, we are working on different policies to help the workplace with getting the appropriate time off, getting paid time off, because some people are worried that if they, take a few weeks off after living donation, they're not going to get paid or things like that. Right. So we do a lot of work with that, and I think it's just a great option. I know plenty of people who've gotten particularly living kidney donation, and they are thriving, and so is their donor. So it's a great option, and I'm all for it.
Excellent. Now, one thing is I told Alin earlier that I've kind of done a little digging into her history off the internet, and I hope this quote is appropriate, one that you had out there. It's as someone who's worn both the white coat and the patient gown, I have a unique perspective on what it means to be a transplant recipient, both emotionally and medically. You've touched a little bit about just the information and like that overall, but what about the emotions that a recipient tends to experience post-transplantation?
It is a complicated process. After transplantation, people focus a lot on the grateful aspect. You wouldn't be here if it wasn't for your organ donor. You have to be grateful for what you have. It's honestly one of the only, chronic illnesses where people kind of feel like there's negativity if you complain about something. You're on a lot of medications after transplant that you can be frustrated with. So emotion, and then some people, because of that, feel like because they have to be grateful, they can't complain, and they kind of hide all the frustrations, and they don't want to tell anyone. They don't want to even tell their doctors because they feel bad about, quote, complaining. And so what I always say is it's important to know that you can feel grateful and also frustrated at the same time. It's not, they're not mutually exclusive. In fact, I try to tell people that we're human, where our emotions are complex, and it's okay to feel both. I do agree that there's a psychological component of transplant that isn't talked about as much. Now, I come from a center. I did my initial my transplant surgery at Penn, so that was my first center that I was at, and I was lucky enough to have, prior to transplant, there's a psychosocial evaluation that happens, and then you see a therapist I was in the ICU. I was pretty sick, but there was a therapist who came in and talked to me about my feelings and how I was feeling. Even afterwards, at discharge, not only did I get a psychiatrist, but a therapist as well through the transplant team. And it's something that's mandatory, particularly with that hospital. And a lot of hospitals do have that, but not every hospital. So I was grateful for that. And I think increasing access to those types of services, and also acknowledging the fact that frustrations do exist post-transplant. Keep in mind, again, there's the aspect of you don't feel like you can speak up as much, and then there's also the prednisone. Prednisone changes your mood. I mean, I call it the devil's drug. Like, I remember I was feeling like I was an insomniac and I was manic half the time, and then I was like unsure about my feelings and I'd suddenly cry. Like looking back, it was absolutely prednisone induced, and I didn't know what to do about any of those feelings. So the part of it is also these physical side effects that you get from the medications that you're on, and then of course you just went through something so traumatic. I personally went through acute heart failure. A lot of people have chronic kidney failure, chronic heart failure, and they have years and years of these mental health issues that maybe they didn't bring up. So I do think it's a big component of transplant that we do need to not only acknowledge, but try to have policies in place to improve care.
Very good. And another thing I pulled on you is, you talk about the setbacks you've had, both when you were going through, pre-transplant, post-transplant, and like that. And you use a great term, an inconvenient life event. Or ILEs. So, how have your ILEs made you a better physician and a better person?
I think that my ILEs, actually, I remember I came up, I think that was the prednisone, because I remember writing that and I was like, oh, that's a great word. And now I'm like, wow, it was pretty good with how I described it. So I think there's two ways to look at something. When something, inconvenient happens to you, or something crazy or traumatic, or, an acute critical illness, or a traumatic injury or something, you can either hate yourself, you can start thinking about, like I always say, I'm like, you can question whatever God you may believe in. You can think of, I remember even thinking like, why is this happening to me? Like, I did everything right in life. I was eating well, I was exercising, I was a doctor, but no, like if you're gonna dwell on all that, then that doesn't change the situation that you're in. That just makes you more miserable. And so I saw it as a way, of course, it's okay to feel like that, but you have to process those feelings and then continue to move on. And I remember when I was thinking these things out loud with like my cardiology team, I was like, yeah, I just got to get that heart transplant and move on. And they were like, you are such an ER doctor. they were like, you are such an of course you're just thinking about like how to get out of here.
Let's get them in, get them fixed, and out the door. Get out, the next one. Yes.
And so it's not that I didn't have frustrations, but I remember I pretty quickly was like, all right, well, I guess I have to figure it out from here. And so I took it as a way to grow from the situation, and that's how, again, it's probably easier said than done. There's a lot that goes into it, and a lot has happened to me. People sometimes tell me things like, you make it look so easy, and I'm like, well, I'm glad I do, but I can tell you it is not easy. It's actually, that just shows how hard it is, because I'm constantly making sure, there's all these appointments I have to go to, there's medications that I have to take all throughout the day, and then people also forget. So I don't know how open I've been about the other stuff, but like I've had rejection. I had to get both my hips replaced from the prednisone. All these different side effects that happened from my transplant. Each time it happened, there were two ways. I'd either I'd be frustrated, and then I'd be like, okay, well, I guess I can get once you go through a heart transplant, there's really nothing else that could be worse in my opinion. So I remember thinking that, all right, gotta get my hip replaced and move on and go back.
Yeah, you talk a lot about the medical side of the recovery and such, but you also need to the personal side of it. You need to unplug, de-stress, unwind, and like that. And again, I've been doing some digging. I've found that you're a bit of an audiophile. Anywhere from an eclectic playlist, old school hip hop, The Weeknd, others, and like that. So what's on your current playlist to help you unwind and decompress?
Honestly, people are always surprised when I say this, but like I really do love Tupac. Like Tupac, got me through my whole hospitalization. I'm from LA, so I feel like I really just love hip hop and rap music a lot. Recently, though, I would say like the last year or two, I've always really liked podcasts, but even more than music, I feel like I listen to more podcasts now. And you would think, because people are like, oh, you probably listen to like calm, nice podcasts. I'm like, no, I listen to like true crime like all the time. Like, my boyfriend's always like, why are you listening to, can't you listen to something like happy? I'm like, no, I don't know. I just kind of like mysteries and true crime and history podcasts. So even more than music, especially recently, I feel like I'm always trying to learn about things, and I'm trying to learn about different events that happen throughout history or true crime events.
Perfect. Well, we're coming upon the end of our time here, but I'm going to open the floor to you. Anything else that you want to talk about, your advocacy, and you'd mentioned earlier, how people can get involved. Anything you want to reiterate? The floor is yours.
I think that a lot of people do ask me how to get involved or how did you get involved. Thanks to the prednisone, like one of the first things I did as soon as I got home, I think I sent emails to like any organization out there with the word transplant in it, and I was like, do you guys need help? Because like I'm going to be off from work for 6 months and have nothing to do. So I honestly just reached out. I reached out to organizations, including AST at that time, which I'm a physician by training, but the societies that I was a part of were SCCM, like the Society for Critical Care Medicine, or ACEP for emergency medicine. I had never been involved with transplant beforehand. So I started getting involved, and the local OPOs are always a great way to get involved. And I think not only does it help you kind of process what's going on, it puts something for you to do while you're recovering, and you understand a little bit more about the donation and transplantation process. So I feel like it's something that if people want to do, it was a really good way to help me heal from everything, and also just kind of gave me purpose. I knew that I was going to volunteer for this one event, 3 months into my transplant. I think that really helped me with the recovery as well.
Excellent. So appreciate your time, Dr. Alin Gragossian.
Yes.
Not only a transplant recipient, but in the medical field, and a strong advocate for those undergoing the transplantation process. So feel free, highly recommend listening to the podcast, Both Sides of the Stethoscope. It's an ear opener, hearing that, and then also the Change Your Heart blog that you've got. I wish you would update that.
I will.
I'm waiting for the next episode, but great information out there. So thank you very much for your time. So we sit here at ATC, American Transplant Congress 2024, live from booth 300.
Make sure to subscribe to this podcast and follow us on social media to stay up to date on all the latest information. If you want to help spread the word, please give us a 5-star review and tell your friends and colleagues to subscribe too. With over 40 years of diagnostic innovation and specialized expertise in infectious disease, pre- and post-transplant, allergy and immunology testing for immunocompromised and critical patients, Eurofins ViraCore is committed to helping medical professionals, transplant teams, and reference labs get results faster when it matters most. ViraCore is passionate about delivering value to our clients by providing timely, actionable information, never losing sight of the connection between the testing we perform and the patients you serve.